Tobacco control advocates have called on African governments to ensure a strong and effective policy necessary for a smoke-free environment in line with their commitment to the World Health Organization's Framework Convention on Tobacco Control. The advocates who made a call at a capacity-building program on tobacco industry monitoring held in Pretoria, South Africa, said though some African countries are making progress, implementation of tobacco control laws has remained a challenge.
It was a gathering of tobacco control advocates, researchers, government officials, the academia and journalists from 11 African countries, including Nigeria, Gabon, Cote d'Ivoire, Ethiopia and South Africa, among others. The aim: to help advocates understand the tobacco industry better in order to hold it to account in furthering progress in tobacco control.
If you're trying to address malaria, you surveil the mosquito and you do measures to stop it. And so it's the same thing. If you're trying to deal with the diseases caused by tobacco use, you have to survey the industry and try to address its interference, which continues to propagate the disease.
This program is supposed to help empower tobacco control advocates in Africa, to help them to be able to be focused on how they interact with the industry and how to make sure that their programs are successful in bringing down the smoking prevalence in Africa.
Available records show that the tobacco industry has over the years interfered in public health policies around the world through the hijacking of political and legislative processes. The industry now targets the African continent to grow its market, raising the need to monitor and counter their tactics.
When you look at the number of litigation in countries where they have their laws and the tobacco industry, going with one litigation or the other in order to prevent the enforcement of those laws, you find that it is really very important that for any government that wants to make progress in its efforts as reducing deaths and diseases associated with tobacco use, they must track and respond to how the industry is trying to slow down such process.
Every day that a government that is a party to the Framework Convention on Tobacco Control delays writing and implementing effective tobacco control measure is a day in which more of the young people, our future, become addicted to unhealthy products.
Participants at this training on tobacco industry monitoring agree that if tobacco control efforts are to be successful in Africa, then the African Union and African governments need to understand, avoid and overcome all the tactics deployed by the tobacco industry to undermine public health policies in Africa, their economy and of course the environment. From Pretoria, South Africa, this is Nkoli Omodu reporting for AIT.